of the nails and feet. Procedure 1. Introduce self and identify the client.
Sir, good evening. I am Saira Charity Dumaliw and I will be your student nurse for this day. So, sir, can I please have your armband? Can you please state your name for me?
Earl Del Rosario,
How about your age, sir?
24 years old.
2. Explain the procedure.
So, sir, for today, I'm going to be performing a nail care for your hands and feet. That is very important for me to clean up those nails so that it can provide you with the most comfort, sir.
3. Prepare the equipment and arrange within easy reach.
So, these are the equipments that I have already prepared beforehand before even starting with the procedure.
4. Wash hands and don gloves.
So, assuming that I have already performed medical hand washing, I will be performing hand hygiene. And after performing hand hygiene, let's assume that I am wearing one of my gloves.
5. Perform physical examination of the hands and feet.
So, sir, let me have your arm. So, I'm going to test it for capillary reflow. Okay, better one, sir. Your feet. The other one. Okay.
6. Place the patient in Fowler's position. Put disposable mat under patient feet if possible, and provide patient with privacy.
So, for this procedure, I will not be letting my patient in a semi-Fowler's position, but instead, I will be placing him in a sitting position. So, after that, I'm gonna put this one under the client's feet. Sir, your feet. And provide privacy for the patient by closing all the curtains.
7. Soaking the foot. A. Fill the basin with 100 with the 7. Soaking the foot. A. Fill the basin with water at 100 Celsius to 110 Celsius.
Okay. So now I will be filling the basin with warm water for about 100 to 110 Fahrenheit.
B. Place the basin on a disposable mat and help patient place feet into basin.
Okay. So sir, I'm just gonna put your feet in here. One here.
C. Soak feet for 15 to 20 minutes, rewarming water as necessary.
So now that I have placed the patient's feet in the basin, we will have to wait for about 15 to 20 minutes so that I can clean his nails on his feet.
8. Soaking the fingernails. A. Place over bed table in low position in front of the patient. B. Fill emesis basin with water at 100 Celsius to 110 Celsius.
So now I will be filling this emesis basin with about 1/3 of 100 to 110 Fahrenheit of warm water.
C. Place the basin on the table and place patient fingers into emesis basin.
Okay, sir, can I have your arm? So I'm gonna let it soak in this emesis basin for about 15 to 20 minutes, okay?
D. Soak fingernails up to 10 minutes if indicated. Rewarm water as necessary. Number 9. Cleaning the fingernails. A. Clean under fingernails with wood plastic applicator stick.
Okay. So, sir, let me start by cleaning your fingernails. Under your fingernails.
B. Trim nails straight across and even with clippers.
So now, sir, I'm gonna be cutting your nails straight. Okay, the other one, sir. Okay.
C. Shape fingernails with emery board.
So I will now shape your nails, sir, using this emery board. The other one, sir. Okay, we're done.
D. Wash cuticles back gentle with washcloths or with wood plastic applicator stick.
Okay, sir, I will be using this moistened cloth. The other one. Okay.
10. Trim and clean toenails as in step 9 for fingernails.
So let me start with your washcloths. Now I will be cutting your nails here. And reshape it using this emery board. Okay, so we're done.
11. Apply lotion or cream to hands and feet. Return patient to bed and position for comfort.
Okay, so sir, now I'm gonna be putting this lotion on your hands. The other one. And on your feet, sir. Okay.
12. Remove gloves and store them in proper container.
Okay,
Clean,
sir.
clean all equipment and store place soiled linen and laundry bag.
Okay, so sir, you can now lay on the bed properly. So after putting the client in a comfortable position, I will now be removing my gloves and dispose it in a proper place. And after that, I'm gonna have to get rid of the soiled linen and put it in a laundry bag.
Wash hands thoroughly.
So now I will be washing my hands to provide safety to the client.
14. Document the procedure.
So after the procedure, I must now document it with my signature in it for any legal purposes and report any significant and abnormal findings to the senior staff. So the procedure ends here. Now let's move on to the return demonstration video. Thank you. Good day. I am Sarijari Didomaliw from BSN 1D of Holy Trinity University, Group 14 for RLE. And for today's return demonstration video, I'm gonna be performing nail care for the hands and feet. So with further ado, let's begin.
Amen.
Good evening, sir.
Good evening.
I am Sarijari Didomaliw and I will be your nurse for today. So, sir, can you please state your name for me? How about your age? Yes, sir, thank you. So, sir, for today, I'm gonna be performing a nail care for your feet and hands. it's very important for us nurses to clean out those parts in order to provide you with the most comfort, sir. So now, sir, I'm just gonna prepare all the equipments that I'll be needing for this procedure. So as you can see, I have already prepared the things that I'll be needing here in this bedside chair. So after preparing that, assuming that I have already performed medical hand washing, I will now be performing hand hygiene. And wear my gloves. So now let's assume that I am wearing my gloves. So sir, I'm just gonna check for capillary refill, okay? Okay. The other one, sir. Okay. On your feet, sir. Okay. Okay. Now, sir, for this procedure, I will not be placing the client in a Fowler's position because it is better if the client stays as seated to proceed with the procedure. So after that, placing the client, I will now place this I will now fill the basin with water with a temperature of about 100 to 110 Fahrenheit. Okay, so now I'm just gonna put this and help the client to put his feet. So now I'm gonna soak the client's feet for about 15 to 20 minutes. So sir, let's just put your feet in here for about 15 to 20 minutes, okay? So now I will soak the client's fingernails by placing this warm water with a temperature of 100 to 115 Celsius or Fahrenheit. Okay? Sir, thank you. So let's soak the fingernails for about 15 to 20 minutes. Okay, so now let's start by cleaning your nails. Okay, so I'm just gonna wipe it. So in order for me to begin the procedure, I'm gonna have to clean out the fingernails under by using a wood applicator. Okay. And now I'm gonna cut it. Yes, So now I'm gonna shape your nails, sir, using this emery board. Okay, now, sir, the other one. So for this procedure, I will not be pushing the client's cuticles because he is not using any cuticles on his nails naman po. So let's skip that part. Okay. Now, sir, I'm gonna cut your nails. Now I'm gonna shape it using this emery board. Okay. Your nails in your hands is now done, sir. Now your toenails naman po. Sir. So I'm gonna start by cleaning up the nails under using this wood applicator. Okay. Okay. Now I'm gonna start trimming it. Now I'm gonna start reshaping it. Now the other one. Okay, let's start reshaping it. So for this procedure again, let's skip the part where I have to push out the client's cuticle because the client is not using any cuticles on his toenails. After cleaning the client's nails, I will have to apply some lotion on his hands. So sir, let me. Okay. The other one, sir. Okay. So now your feet, sir. Sir. Okay na po, sir.
Di ba?
Sir, the other one.
Kaya sabihin,
Dito po.
yan. Kawalang mga gilid mo, gilid. Kawalang gilid. Yan. Okay na.
So after cleaning the client's nails and after putting the lotion, I will now be removing my gloves and place it in a proper place. And after that, I will have to remove the things that I have used and place it in its proper place and discard the soiled linens and place it in the laundry bag. And after all of that, I will now be performing medical hand washing to provide cleanliness and aseptic to the patient. Document the procedure for any legal purposes and report any significant findings and abnormalities to the senior staff. So, sir, we are now done with the procedure. Thank you for your cooperation.